It's Myra here from Mind Body Soul UK. Hi, it's Myra here from Mind Body Soul UK, and today I have a very special guest, Dr. Dani Gordon. Would you like to introduce yourself?
Sure, thank you, Cher. So my name is Dr. Dani Gordon. I am a double board certified medical doctor, and I specialize in a type of medicine called integrative and cannabinoid medicine, which is basically evidence-based natural medicine combined with conventional medicine to treat chronic illness and for resilience.
Amazing, amazing. Love that. And you have 10 years experience, is that right?
Going on almost 15 now,
Oh,
actually.
wow. Okay.
I think that might have been a bit of an outdated I might have to change that. But yes, almost 15 years I've been doing this
15
now.
years. That's amazing. And what kind of things do you do to treat your patients?
So, it depends on who I'm seeing, of course, but I see a lot of women in my practice. I would say at least 75% of my practice is women. And
Amazing. Love that.
so, yeah. So I do a lot of women's health work. And not every problem I see is related to periods or to perimenopause, although I do a lot of that too. But it's just being a woman, chronic illness and chronic health issues affect us differently. So I tend to treat a lot of mental health conditions as well. So a lot of
Amazing.
stress, burnout on the milder end, and then on the
Yeah.
more severe end, a lot of depression, including treatment-resistant depression, um, severe anxiety disorders, severe sleeping problems, PTSD, as well as conditions affecting the energy system. That's one of my niches, is specializing in chronic fatigue spectrum illness. So I see a lot of people with chronic fatigue syndrome, long
Yeah.
COVID and chronic fatigue from burnout. So it's a big bucket. And then I also treat a lot of women with chronic pain disorders. So fibromyalgia, endometriosis, autoimmune disease causing pain. And, it seems like these things don't come together, but the thing is they do, because
Yeah.
most of my patients, they have more than one problem going on. It's not like they just have over on one side of the room, apart from everything else in their life, they're a little bit anxious, and then they don't have anything else going on. So it's really integrated medicine really brings these things together and approaches people as a whole being,
Yeah.
rather than just treating each symptom and patchworking things in isolation with another pill and another pill and another pill. So basically I use a holistic approach to get people well, and most importantly, help them recover their resilience, not just get them not sick. I hate
Yeah.
this idea of just making people not sick. It's really about more than that, isn't it? It's about, like, you want to live your life. You want to be able to feel like you're really thriving. So
Yeah.
that is what I do with patients.
Amazing. And what made you get into this field?
Well, I had, of course, like many people who get into more holistic areas of medicine, I went to medical school in the conventional fashion, graduated and so forth. And I was
Amazing.
always interested in, nutrition and holistic practices. I did yoga even as a teenager. I was a high level athlete, so I was really into kind of mental practices, meditation,
Oh,
that
wow.
sort
I
of
love
thing.
that.
Yeah, so I was always into those things, but I also had my own health issues. So I had from when I was little, I was on antibiotics until I was 13 years old for a bladder condition that I was born with, and
Wow.
that left my
Okay.
that left my immune system, I think, a bit funny. I used to get sinus infections all the time as a teenager. I was always sick. I was always on antibiotics. And then when I got into medical school, I was really just struggling with stress, just keeping up with stress. And so because of my own journey, really, I got
Yeah.
into integrative medicine.
I love
Because
that.
even when I was in medical school, I was seeing that, these things that we were doing with patients, drugs are not all bad. Sometimes you need to use medications, but it
Yeah.
wasn't making people well who had these chronic illness conditions. And even the doctors who were treating these patients, they were burned out, they were stressed out. A lot of them were on medications for stress and burnout and mental health too. And I just felt like there had to be a better way to do medicine. So that's really what brought me to integrative medicine.
100%. I love that because I think it's so important for people who work in like health or even fitness. you know, because they have to take care of their health as well at the same time. So I think
Yeah,
that's really good. So you work with CBD as well. What would you say
yes.
are the benefits?
So I work with CBD, yes, but also medical cannabis. So
Yeah.
as part of my integrative toolkit, I treat a lot of patients with medical cannabis. So that are those are medicines that contain CBD as well as THC, which is the compound in the plant
Okay.
that people know, through kind of media as making them feel high. But actually, in small doses, THC, when used medicinally, when used in the right context, doesn't make
Yeah.
people feel high, but it can relieve pain. It can help sleep. I use it in a lot of my patients who have perimenopausal symptoms. So yeah, medical cannabis is probably one of my most powerful tools in my integrative toolkit. I've treated thousands of patients with medical cannabis over the last decade. And I've trained a lot of the first UK physicians in medical cannabis here in the UK. And I do a lot of advocacy work around medical cannabis. But and it's not for everyone. But what it can help with is in a lot of these chronic conditions where you have these clusters of symptoms,
Yeah.
you have pain, you have sleeping problems, you're feeling anxious, you're feeling brain foggy. Medical cannabis can help with a lot of these different symptoms at the same time, and it can really give people a quick win and reduce all these different pills that have been piled on top of them that are not really doing much for them.
Yeah.
And then once we get them feeling better, then they can do the other really good stuff too. But if you're feeling so awful because you're in pain and you're stuck in bed and you're so anxious because your nervous system's so hyper aroused, there's no way that you can meditate or exercise properly or eat better because your nervous system's overwhelmed. So that is really what I do with a lot of my patients, is using the medical cannabis to really help them
Amazing.
recover the first bit of their life.
Yeah. So it's more of like a natural remedy, would you say?
It it is natural. Of course, it's by prescription
Yeah.
when you use medical cannabis with THC. But it is natural, and it's using these full plant medicines. You're exactly right. And this is not a new medicine. This medicine's been around for thousands of years. We've just
Yeah.
kind of co-opted it back into modern medicine recently. Um, so it is natural, although of course with THC you do have to be careful. It should be done under medical guidance. It's not for everyone. But it works so well for so many of my patients.
Love that. And do you combine these medicines with meditation? And if so, how do you do it?
Yes. So one of my favorite things to do is to combine medical cannabis with a mind body practice. And I've just written a book about, resilience and a lot of the mind body practices I do, because the thing about meditation is it's not one size fits all. So
Yeah.
not everyone just jives with mindfulness. Um, Not everyone responds to a relaxation breathing practice. So the first thing is finding out what is the best practice for a patient. So if they're really, really fatigued and they have no energy to really mentally engage with a more kind of cognitively demanding practice, I would recommend something like Yoga Nidra, which is a really gentle guided practice. And I give people recordings to listen to. They go home and they listen to an MP3 that I give them. And then
Nice.
I can, yeah, so it kind of like guides them along the way and gives them a practice that they can really um, get into and really enjoy and
Yeah.
stick with. And the other thing about meditation is, even if it's the right practice for you, if you're not used to meditating or doing a mind body practice, it can feel very overwhelming. People can procrastinate.
Yeah.
Um, and that's where medical cannabis comes in. So usually what I have patients do is take their medical cannabis and then do their meditation, because it's already puts the nervous system into a calmer state from the medical cannabis. It's kicking in, and then they're in a better state of mind to be able to do their meditation. Medical cannabis with a little bit of THC can actually shift the brainwave activity as well into what's called a more relaxed but alert state. It's called alpha brainwave states. It's a
Okay.
bit more complicated than that, but basically that's how it works. And when you're in this state, when you can use a substance to shift you into that state, then you're more receptive to being able to sit and meditate. And then over time, what happens is, eventually you might not need the cannabis anymore to get into that state. You're just training your brain towards that state, using it as a helper in the beginning. And using that combination, I've had so many more of my patients who were not able to meditate before actually stick with their practice and
Nice.
get those, get those benefits.
Yeah, that's amazing. Love that. So working with therapeutic psychedelics, what are the benefits within Canada and the UK, would you say?
So right now in the UK, we only are able to use therapeutic psychedelics in a research capacity for most substances right now. So that includes psilocybin for magic mushrooms. That includes DMT, which is isolated from an Amazonian plant and is
Mhm.
commonly used in what's called ayahuasca. Um, and there's others as well. So for those substances, it's sometimes possible to see if I have a patient who I think might benefit, if there's a research study ongoing that they might be eligible for to apply to enter into. But
Okay.
that's obviously, not most of my patients. However,
Yeah.
we do have the ability here in the UK now, and we use it clinically now, is using another medication called ketamine for its psychedelic therapeutic properties in conditions like treatment-resistant depression and treatment-resistant pain. So how that works is it's usually done, the first dose is usually done with an IV, although it doesn't have to be, and it puts people into an altered state. And this can help kind of jiggle up pain pathways that have been really stuck, depression networks, kind of shake everything up in the brain so that people can get out of these stuck loops when, for example, psychotherapy alone hasn't worked for them, medications alone hasn't worked for them. And it can be extremely, extremely effective in these cases.
Wow. Okay, I've never heard of that actually. Sounds really interesting. Um,
Yeah.
so you're a mum as well, is that
Yes,
right?
I am. I
Yeah.
am a mom.
Amazing.
Do you have kids as well?
No, not yet.
It's a whole, every day is an adventure when you have kids.
Yeah, you got to love kids. How do you balance being a mum and also looking after so many patients as well?
Well, it's not easy when you're working, when you're a working mom full time. I work full time and I have a 2.5-year-old son. And, I'm self-employed. I went back to work far before a year. I was back to work full time when he was 6 months old. So it's not always easy. I have to deal with mom guilt just like everybody else. And then just juggle working full time and having enough time for him and doing all the things that you have to do as a mom, as well as, just keeping up a household. Um, but how I take care of myself is I really try to use practice what I preach with my patients. So I do take time for myself. I do meditate in the evening once he goes to bed. And I just try to be kind with myself and just not be so hard
Yeah,
on ourselves. I think for as women in general, we're very hard on ourselves. We're the caretakers, even if we're not moms, we're always caretakers.
yeah,
And
true.
and we're always the ones looking after other people. And when you become a mom, it goes to a whole new level of that. So and I see a lot of moms in my practice. A huge percentage of my practice is actually young moms because what I found being a mom myself is there's no manual for how to take care of yourself as a mom out there.
Yeah,
There's lots of parenting advice, and sometimes that's great, but sometimes that can be overwhelming when you go on Instagram and all you see is like, oh my gosh, am I doing this right? Am I doing a good enough job?
yeah,
But there's not really a manual for how do you take care of yourself. So
yeah.
um,
How do you love
you
yourself?
know, how do you love yourself? How do you take care of your sleep when you have to be up with a toddler or an infant, when you're breastfeeding? Like how do you do that? Because you can't just say to a new mom, "Oh, just go to bed really early tonight, get your 9 hours, and then you'll feel better." You have to actually tailor the strategies for moms with young
Yeah,
children. Um, so that's what I tend to do in my practice. And it's what I always say to my patients is the myth, there's this myth about perfect balance. Perfect balance doesn't exist. It's always a constant kind of dance and a trade-off. But it's just a combination of doing the biological things that are really good for you that work for moms. So
yeah,
supplements, natural botanicals. I use a lot of botanical medicines, use a lot of mind body practices. but different than my non-moms, because moms don't have time to meditate for an hour. I mean, let's be honest. You're running
Yeah.
around chasing after your kids, and then if you work, it's even harder. So it's just tailoring these practices to being a mom, and being a mom myself has made me even better at doing that, I would say, than I was before.
Yeah. So using the practices for yourself as well.
Using the practices for yourself, and
Love that.
just really, yeah, just really trying to, the end of the day, it's sometimes just about doing less, and just feeling, like you have that ability to let yourself just not be perfect. It's,
Yeah,
this idea of perfection, it's so harmful for our well-being.
definitely. Nobody's perfect. Love that. So how does meditation change our genes? And how do you find the best practice for each person?
So meditation, there's been loads of research done over many, many years on the different forms of meditation and how they might impact our brains and our bodies in different ways. And some of the most interesting work, I think anyways, has been done from some colleagues at Harvard University. So Dr. Sarah Lazar, Herbert Benson, they're really the leading experts in this area. And they have been for many years. I had the absolute thrill of studying with Dr. Benson at Harvard in
Oh,
Mind Body Medicine
amazing.
years ago, even when he was still teaching. He's I think he's about 90 now, or almost 90. And I learned so much from working, studying with them. And one of the most interesting things was about their studies looking at how even 8 weeks of a 20-minute meditation practice can actually turn off certain genes for inflammation and turn on genes for resilience. And this is across different disease states, cardiovascular disease markers, autoimmune disease markers. There's so much going on when we start to do some of these practices, and
Mhm.
it's not just making us feel better. It's actually changing our chemical physiology. Um, so
Yeah,
it's really
love that.
cool. It's really cool. And what I always tell people, if you're not sure where to start, try mindfulness first, because it has benefits for what I call all the different resilience types. So I tend to talk about people, we all have a different resilience type. But
Mhm.
across all the resilience types, mindfulness is quite useful. Um, and I talk about this. I just wrote like I think I mentioned before, the book that I just have coming out in a few weeks about, it's called The Resilience Blueprint. So it talks about how to
Ooh,
find,
we'll check that out.
yeah, yeah. So it talks about how to find your meditation type, your mind body practice type for your resilience type.
Yeah.
So mindfulness is a nice one for everyone to start with. But if you're feeling, excuse me, very low on energy, that's when something like a really gentle, guided, low engagement practice like yoga nidra can be very helpful.
Mm,
If you're really,
okay.
if you're really like wound up and you're anxious, then something like a calming breathing practice called the healing breath can be helpful, or a practice such as Herbert Benson coined at Harvard called the Benson technique, where you just repeat a single word or phrase every time you exhale. I like to use the word peace or love, but you can just use the word one. It can be, so there's a whole technique around that. If you're struggling with depression and low mood, there's been research into looking at how compassion and loving kindness meditations light up those brain areas that are decreased when someone gets depressed. So compassion, loving kindness, if you suffer from depression. And if you have trouble with focusing and concentration, then I sometimes will prescribe someone a concentrative form of meditation to kind of help with their focus. So it can get quite specific, but it also can be very, very simple. And just 10 minutes of mindfulness a day can make a big difference in 8 weeks.
Love that. Love that. I think meditation is a really good key when it comes to mental health, you know.
Yeah.
Um, what would you say the biggest barriers you face are?
Biggest barriers in my work or
Yeah, and your
in,
profession overall.
well, I think one of the biggest barriers is, I think, just decreasing the stigma around medical cannabis. I
Yeah.
think a lot of my patients are coming to me for the first time, never trying cannabis, being a little bit scared, but they want to try it, but they're not sure. And they
Yeah.
might have been told by another doctor that cannabis is bad, it's harmful, cannabis is going to make everyone go crazy.
Yeah.
So because of particularly the work that I do with medical cannabis, that's one of the biggest things. So in order to counter that, I do a lot of educational work, a lot of nonprofit work, lecturing, teaching other doctors, teaching university students about not just medical cannabis, but about our endocannabinoid system, which is this
Amazing.
system we all have in our brains and our bodies that helps us basically use plant cannabis chemicals in the brain and the body.
Yeah.
I think another challenge I face obviously is just juggling things as a mom. So that's always a challenge, I think.
Yeah.
And other than that, just keeping on top of all of I'm in a field where it's very fast moving. Integrative medicine is always changing. So keeping on top of all of the new developments is something that is extremely important to me, to be able to offer really cutting edge treatments for my patients, and keeping on top of it all is really time consuming. But on the other side, I love what I do, and I literally would do it, all day, every day, if I could. So I think as long as you love what you do, these are barriers that are easy to overcome.
Yeah. I love that. I love that. I could tell you really have a passion for it. So that's really good. Uh, so you mentioned your book. Can you tell us a bit more about it?
Yes, so my second book is coming out on April 13th with Hash It here in the UK.
Amazing.
And thank you. And it's been my baby for the last 2.5 years, on top of my other baby, who is now 2.5.
Oh,
Yeah, so I wrote this book when I was pregnant. It's about resilience and really, how to create your own self-care resilience program.
yeah.
And it's really close to my heart because I had a lot of resilience ups and downs when I was writing it myself, and I was using these practices myself. I had COVID quite badly when I was early in my pregnancy.
Oh, wow.
So that was a big challenge to overcome. So I was using a lot of these things myself. And even just going through having a baby during COVID, where I couldn't have anyone with me in my, when I was delivering the first day in the hospital, I was by myself. All these
Oh,
kind of,
yeah,
you
because
know,
it was 2.5 years ago. That was 2020.
yeah, yep,
Yeah.
yep, exactly.
Oh, wow.
So there's a lot of things going on in the world and in my personal life. So at the time where I was really using a lot of these tools, so it was really quite therapeutic to write it and to share, these things. Not only that I had to use with my patients for the last 15 years, but I'm still using them myself.
Yeah.
So the book helps you get your resilience type, and then after you get your resilience type, you take an assessment, and then it guides you through all of the different parts of my resilience toolkit, for mind body practices, diet, supplements, sleep, cannabinoids, power plants,
Wow.
and it guides you how to put together your own plan in an 8-week program.
Love that.
So I'm really excited about it because, not everyone can come see me as a patient. It depends where they live. If they're outside of the UK, I can't see them as a patient. And I just wanted to make it really accessible to people to empower themselves
Yeah.
about their well-being, because there's so much we can do ourselves if we have the right tools.
Yeah. I agree. That's amazing. Congratulations on your book.
Thank
I'm
you.
going to check it out when it comes out as well.
Thank you very much. I'll definitely send you a copy.
Amazing. Thank you. So what would you say is the best way for you to manage your mental health?
For me, I find it's all about, like, not expecting perfection and just being kind to myself. Self-kindness for me is number one.
Yeah.
Um, I do take a lot of supplements. I do meditate. I do all those things, but at the end of the day, those things are great. But if you're not being kind to yourself, then there's still a lot we're missing. So I'm not always great at being kind to myself. I have my bad days like everybody else, but I really do try,
Yeah.
because I find it so helpful. The other things I find helpful is I do have a short mindfulness practice that has become a lot shorter than it used to be now after I've had my son, but I still tend to do it. I'm very lucky to have a very small one person infrared sauna at home, which I invested in because it's my favorite thing to do. And now that I don't have time to go to the gym all the time, my practice in the evening involves basically putting my son to bed, going in the infrared sauna, doing my meditation. And for me, that's a really nice way to have that me time,
Yeah.
to keep my mental health, good. And the other thing I do is I still dance. I've gone back to dance after I had my son, just usually once a week. Sometimes I go twice. Having that passion outlet in my life has been so essential, for my mental health, my mental well-being, and just my sense of joy.
Love that. Love that. You seem very balanced.
Well, I have bad days like everyone else, but it's all about how we can rebound. We don't have to be this
Yeah.
perfect balance all the time. That's just a total myth. There is no perfect balance.
Yeah, it's true. So what words of wisdom would you give to somebody who might be, struggling with their mental health?
The first thing I would say is definitely always speak to your GP. And I know that is always it's always the thing that we should do first, but sometimes we're not able to because our GPs might not be able to see us for a few weeks. Or, it's the NHS is under so much pressure right now that unfortunately not everyone can see a GP right away anymore. So
Yeah.
if you can't speak to your GP and you're feeling really quite bad, there's always the Samaritan's helpline, which I always say it's free and it's a helpline anyone can call if you're
Yeah.
having more kind of acute, more severe, concerns about your mental health. And they just provide such an amazing free service for people.
Yeah. Samaritans is really good, actually.
Samaritans is really good. Yeah. And besides that, it's just taking really good care of yourself, giving yourself that time that you need to unwind, trying to just take on less, say no more. And of course, seeing an integrated medicine doctor for a holistic well-being, a mental health assessment. I find that's what I do for my patients. So of course, I find that very helpful for them, especially when they might have already tried a medication and it didn't work for them, or they had side effects, which is very common. So taking that holistic approach to mental health, I think, is very, very important and really, really quite effective.
Amazing. Amazing. Love that. And if you had to choose 3 words to describe you focusing on women's health overall, what words would you use?
So I find when I work with patients with women's health, I guess my 3 goals of treatment would be to empower them, number one, about their women's health,
Love that.
to give them resilience, number 2, and to give them relief from their symptoms. So that's really kind of,
Amazing.
what I want to do with patients when I see them for a women's health concern.
Yeah. Love that. And where can people find you if they want to look you up? Website, Instagram?
I am on Instagram. I'm just at Dr. Dani Gordon, and my website is londonresilience.com.
Amazing. Amazing. Well, I think we've covered everything for today. So thank you so much, Dr. Dani Gordon. Really appreciate it.
You're
And
very welcome.
I think what you're doing is really amazing. And yeah, just keep inspiring others to take care of themselves because I think it's really important.
Yeah, I think we all need it more than ever now.
Yeah, definitely. But yeah, thank you for coming today. We finally got
Thank
around to
you.
it, so I'm
Nice to
grateful.
be here. Thank you so much. It's nice to be here.
Thank you. Bye.
Bye.